Drumheller Point of Care and Warming Center.
By Tamina and Tori.
A survey conducted in Drumheller identified that 26 people are unstably housed, with the assumption of more in the same situation throughout the surrounding rural areas. Currently, there are no emergency shelters or accessible points of contact within the area.
With feedback from stakeholders such as nurses, doctors, and additional workers, we decided Drumheller is in need of a warming center, wound care, mental health referrals, and harm reduction. Common complications from weather-related injury, infections, and mental health or substance use lead to a high rate of hospitalizations. It costs a lot of money to house somebody in Alberta for an illness, over $7,000, with the reported 15.3% of people discharged for frostbite identified as homeless. Canada also has an annual expenditure of over $300 million of infections of the skin and subcutaneous tissue. In Alberta, 26% of HIV cases are among those who inject drugs, with 17% of total HIV contractions due to shared use of equipment.
People who use substances are 3 times more likely to have mental health concerns. Stigmatizing behavior exhibited from healthcare providers and the location of limited services in the area can prevent this marginalized population from accessing care.
The cost of inadequate primary health and health promotion in regard to substance use are expensive. The estimated cost of lifelong infections such as HIV and hepatitis is $1.3 million per person. In 2020, healthcare costs related to substance use were $13.1 billion. Hospitalizations in regard to substance use accounted for 24.5%, physician time for 37.4%, and prescription drugs for 28.5% of the annual total.
Between January and June of 2021, the Government of Canada reported 708 opioid-related deaths in the province of Alberta. Our goal is to improve the overall quality of life for people in vulnerable situations, including the homeless and those with mental health or addiction concerns. This will be alongside primary prevention efforts.
Harm reduction services such as needle distribution are preventable measures to reduce prevalent adverse effects such as hepatitis and HIV.
Harm reduction also decreases public crime rates relating to consumption and consequently reduces debris and harmful sharps throughout the community.
In addition to harm reduction, the center will have staff fully trained in overdose reversal and prevention. Studies of naloxone-based programs show that for every dollar spent, $2,700 is saved and deaths avoided.
Our center hopes to see an increased number of people accessing the services throughout the first quarter and an increased quality of life for each client. In addition, we hope to see a decrease of hospitalizations and decreased number of deaths due to overdose. This will reduce costs on the healthcare system.
If you are interested in exploring more of the project, or are curious to certain other aspects of homelessness and harm reduction, or would simply like to see our sources, please facilitate these QR codes. We'll give you a minute.
We would like to thank you for watching our presentation today. We hope you learned something, and good luck in the future.